This is, of course, Dr. Henrik Jungaberle, the co-founder and director of the Mind Foundation and Ovid Health Systems as well, which offers ketamine-augmented psychotherapy and is partnered with the Mind Foundation. He is, of course, also one of the scientific directors of this very conference. And today, he's going to talk to us about how our understanding of integration has deepened and developed in recent years. So please give him a very warm welcome.
So thank you very much for attending this session. I have to start with really saying thank you to my previous speakers. I was very impressed by the case study. I was impressed by David's talk. So we are presenting very different aspects of what integration can become in the next years as a central part of the psychedelic self-development and therapy journey. Forgive me, some maybe happening spelling mistakes here. I made the presentation last night. So, yes, this is how we moved on from forming a program together with David, Andrea, Regina, and we created this course to give structure to a process and to a term that is often used very lightly, and I'll talk about it in a minute. This is our integration room. We call it the atelier, and as David pointed out, this is now how patients also, after getting ketamine-assisted psychedelic therapies, work on their experiences, non-verbally, verbally, working on what they experienced. So, the goal of this talk is to understand psychedelic integration a little bit better, maybe bring up some ideas that you can use, that we can use, and what we can do with psychedelic experience. I called it conceptual engineering because conceptual engineering focuses on how to improve concepts. We can actually look at a term and turn it around in a way, design it so that we can make use of it. Because part of my academic journey from 1996 on until 2003 was working with the theories of Lakoff and Johnson. Lakoff and Johnson, cognitive scientists and philosophers, and they came up with that theory that the most important words, terms that we use have a tendency to become empty. God, man, the universe. So because they become empty, everybody projects their own ideas into them. And that's how divergent interpretations of terminology develops. Conceptual engineering is just a way of clarifying it for a certain situation, and that's what I'm going to talk about. Maybe in a more experimental way than my content overview tries to convey. So, what's that? That's a landscape, and Google wants to make us believe that's how a landscape could look under the influence not only of the Google paradigm, but also maybe as under the influence of a psychedelic experience. Psychedelic experiences can become strange, bizarre, hard to find words for. You meet inner beings and outer beings with strange hairstyles. You meet people and ideas and experiences and pains from the past. And you also sometimes have very uniting experiences, blissful connections with people. And all of this, being positive or negative, can be overwhelming. So why is integration happening, or why is it necessary at all? Because of this structure of some experiences to take you out of your normal way of thinking, feeling, being in your body, being in your social field. Sometimes they can be problematic, traumatic, confusing, chaotic, not understandable, boring, plain, not meaningful. And a very common way of dealing with phenomena like that is forgetting. So maybe those of you in the room who had psychedelic experiences know that this is a common theme when people talk about integration. Oh, we need more integration. It's such a fascinating experience. We need to integrate it, but they lack tools. They lack time. They often lack also the willingness to spend some work on it to make something out of the experience. And that's a topic that I would propose also as a, you might have read it in the conceptual engineering description. We can also bring ethical or attitudes or goals in it when we talk about integration. I think that's exactly what we should do. Just looking back a little bit, I'm not talking about that in depth. We also, in qualitative investigations, we have found a number of potential mechanisms how these therapies and also self-guided experiences may work. And one of them is connectedness. Others are breakthrough experiences, and all these what people call mystical experiences. I have a tendency, and we have to write about it, to call it immersive experience, because I think we need more neutral descriptions of what's happening there, not to take away the mystical from the experience. People experience what they experience, but just to talk with less prejudice or less suggestion about it. So, let's dive into the language again to understand the phenomenon a little bit better. What's actually good and interesting is integration can be understood as restoring of wholeness, of including things that have slipped out of your attention, or that your tendency to avoid pain, which is a very human tendency, has just put into forgetfulness. So wholeness formation lies into the whole etymology of the word, which comes from Latin integer or Greek entagros, and means untouched, intact, whole. Now, can wholeness be reached in this world? Probably not. Wholeness is always something that is in a dialogue with fragility, with vulnerability, with destruction. But wholeness is also something that we need to go for in order to be able to living in this world. There is a sociological way of understanding integration. That means integrating people into larger social groups. And psychologists have thought about it for more than 120 years, as you can see from this citation, that unification, completion, unification, processes of wholeness are part of the psychological process. And Janet, who was one of the founder of hypnotherapy, psychotherapy, has interpreted phenomena like hysteria, dissociation as a lack of integration. One step deeper. Disintegration. We talk about it when a person or a system experiences not functioning, experiences I am not in the depth of what I can be, or to speak Jungian, I am that the shadow, the unseen, the unfelt has a too large meaning in life. So functional disintegration, functional integration, poor conversion of psychedelic experiences can be part of that experience. So, conceptual engineering. Now, something that we propose, going from very simple sentences to a little bit more complex understandings of integration. Integration is learning from a psychedelic experience. But you could also mark out the psychedelic. Integration is learning from extraordinary experience. It can be love. It can be a deep sexual experience. It can be anything that somehow moves into your mind as something very special that has a meaning in your life. And learning from the psychedelic experience that's where a normative component comes in, and I'll talk about why. I think it should have always a component of learning to create valuable behaviors from it. Something that outside of the psychedelic experience enriches your life, helps to make it better, creates better relationships, or helps you to understand yourself in a really provable, functional way better than it did before. Why do we have to say that? Because there are a lot of people, and maybe you find it in your own biography, who try to search for something in the psychedelic experience and seem to come up with very little to preserve or forget. By the way, part of the MDMA experience, and that's why I consider MDMA maybe an even harder experience to do integration work with than serotonergic psychedelics, because people forget a lot of what they experience, what they talk about, particularly in that flash of talking that they experience. And more than once in therapy sessions, but also in a non-therapy context, when you ask people that you have maybe accompanied, what happened? You get a few words and a few topics, but a lot is being forgotten. So memorizing is part of the integration process. Take it a little bit more to the scientific knowledge. So schema psychology. Schema psychology, one of the founders, of course, was Jean Piaget, and he created those terms assimilation and accommodation. Maybe let's remind us of it. Assimilation is an adaptation process by which new information is taken into previously existing schemata. So you might have read one book by one of the old guys, Terence McKenna, and so on. You go through a psychedelic experience and you interpret it with his terms that you had come up with. While accommodation is the process by which pre-existing knowledge is altered, because you experience something, I don't know, I don't understand it, I don't have words for it, I don't have concepts for it. The words, by the way, we shouldn't talk about words in a disrespectful way when it comes to psychedelics and altered states of consciousness. Words are not the things that you put on a paper. Words are schemata. Words are deeply embodied beings in your own universe, sometimes very emotionalized, sometimes very abstract. Yeah? Yes, another theory that is very interesting for the future of understanding integration. We don't understand a lot about integration yet. We're doing things, but we don't have the scientific terminology. To my knowledge, we don't have a well-working questionnaire. That's up in our plans for next year to start an integration questionnaire. Another interesting theory is a theory of consistency. Invented by a German psychologist and psychotherapy researcher. It assumes that an organism strives for agreement or compatibility of neuronal and mental processes that run simultaneously. Grave called this state of agreement or compatibility consistency. The higher the consistency, the healthier the organism. And he, in his theory, that we, by the way, use a lot in this psychotherapist training, he worked on some of the works of Epstein and others coming before him, and is working on 4 basic psychological needs that people need to fulfill to lead a healthy life. Yeah. Integration, that's where I follow what David has begun. Of course, you can look at integration as being a process. Before a very intense experience, during an intense experience, after. This is certainly true. That's a way to look at it. It's also a state. At any time you can look at a person or person at herself, himself, how integrated are my experiences from the past. But then it is also an attitude that could become, hopefully, a social norm. And that's where it comes in with the ethics of psychedelics. I don't believe that psychedelic experience is about making the next psychedelic experience. That is having drug experiences. Yeah, psychedelic experience is about learning something to improve the life of yours and others. And that's, I think, what could and should become a social norm. And looking at it like that, it defines also a relationship between an element that you just have in your focus, something, an experience that somebody expresses in a Beyond Experience group or at the family table. And how does that relate to the whole of the being of a human with all his values? That's the question where therapy transforms into a lifelong self-development process. We have a short form for this interpretation of integration, and it is called integration as wholeness in connection. Wholeness, not only of your inner parts. Jungian psychology often has a tendency to move you deeply into an internal world of pictures, of mythology, of terminology. But there is also that very important other connection. This is the people, the real people in your life, your work colleagues, your friends, your partner. And how do you do something with the intent, with the content of the experience that makes sense not only for you, but also for others, so that you can add to the process of becoming a better human being. Not that we have to become better human beings. We don't have to. Yeah, we can just be. But some of you, I guess, and some people want to become better human beings. And in the process of developing your own process of self-development, this wholeness in connection dimension might become important. We have, particularly in the last 3 years, worked a little bit on culture of consciousness. This is an idea of Thomas Metzinger, the philosopher Thomas Metzinger. And in the core of his idea of culture of consciousness is that not every form of every state of consciousness is as valuable as others, particularly when we are aware of the values that we're striving for. In altered states of consciousness, people can also go deeply into their destructive and brutal and aggressive sides. That's where it's obvious for everybody that we need to create a system of values where we that help an individual and a group to think about what do we want to nourish and maybe to train after a psychedelic experience. So there is that magical, mystical belief related to the magic pill narrative that, well, I don't feel fully integrated. Then maybe the best idea is to have another cup of ayahuasca. Yeah, so just do it again and do it again. And while there may be benefit to that approach, in my 25 years of looking at people and drinking ayahuasca and having other psychedelic experiences, I do not believe at all in this approach. So I have in my research project at the medical psychology 13-year research project, I have accompanied people who drank 1,200 times ayahuasca in the course of 10 years, and comparing them to some who had drunk 10 times ayahuasca, I couldn't find a qualitative difference that would come from the drinking, but I could find a lot of qualitative difference in how they related to these experiences. A little bit more technical, not diving deep into it, but just showing you what we work on and maybe pointing out one aspect. I'm not going through the whole thing. So this model works on the assumption that there is something like integration work, that an effort needs to be undertaken to bring up material. Sometimes the material itself brings itself up. And that integrational dissonance is a state where somebody coming out of a session, going to Ingmar Gorman's therapy, somebody coming to our own integration groups, or a friend of yours having done LSD last weekend, coming to you, talking about it, has a feeling of something is strange, I need to do something, the bewilderment, whatever. In order to achieve a state of larger consistency of integration, resources need to be in place. And resources could be personal, cognitive resources, but also techniques of the self, some of these that we try to train in those groups. And again, always active and intentional confrontation with material. Why are we stressing it also in this model? Because there is a tendency to go for full harmony, to go for full forgetting that life always has components that lead to suffering, that are not to be solved permanently. I started the conference with that. You see, it follows me. And again, maybe also comparing some of the psilocybin experiences to MDMA experiences. MDMA in some particularly recreational contexts has a tendency to make the world very comfortable. Some people manage it to not go to their traumas. So maybe it's important to look for harmony and our tendency for harmony, to see where hidden treasures lie. So triggers of integrational dissonance, which is valuable, can come from very different patterns, very different sources. Not only psychedelic experiences, but also from your environment, where people meet you after the LSD weekend and you seem strange and you feel strange. And then you create a tension. Then you create a strange, I don't belong here really, maybe a conflict. And these are all triggers of integrational dissonance. I could talk about it for another hour. I will not. Just pointing out to you that we are working on such a model and also creating a questionnaire out of it. So trying to get some order into how integration is really performed in the world out there. Most of the integration processes are probably, if we start from the bottom, are processed unconsciously, half consciously, or self-conducted. So we are not saying that everybody who has a psychedelic experience needs to go to a therapist or to an integration group. Not at all. So a lot of people get along well with it, but then there might be a need with some. It might be coming from a therapeutic topic, traumatic topic, or from something very blissful, to work deeper on it, and it could be done in facilitated self-experience. I think the Footsteps and Beyond program is something like facilitated self-experience. People can go to coaches. And there would also be integration psychotherapy. And I think the field will profit from developing these structures in a more structured way. I hope that there will be programs coming in from other organizations that will compete with the Mind Foundation's programs and so on, and that we will have an own integration research in the future, and hopefully can also report about that in 2023. Yeah. And in which formats could something like that be done? It could be done online, single, and group. By the way, we started to have integration therapy in our own practice in Ovid, and we're learning such a lot. We have such fantastic cases, people coming to us and talking about their experience, and there is a lot to work up. When somebody really talks about what happened, this is a rich material that you can work with. Then integration groups, small, large groups, stable groups, open groups. So the terminology of integration circle, I don't really know if there is something like a similarity between them, but sometimes people sitting together in an integration circle, of course, then the group factors that David talked about are present. But I often met people from integration circles, unfacilitated integration circles, that are in need of concepts, of methods, of anything to take the group to a goal or to an end. Yeah. So we might want to do that in the future. Then, of course, coaching processes and formal therapy. I'm a proponent of also making it clearer in the future that therapy is therapy, a formalized setting. 1 minute. Yes, I'll jump to the conclusions. A formalized setting in which a patient relationship is established. Of course, therapeutic effects can happen outside of therapy too, but it's something very different. So David talked about that. You know that already. So jumping through that and going to my synopsis. Psychedelic integration can be defined as learning from psychedelic experience. An important dimension of it is assimilation and accommodation, which can be well researched, by the way. Yeah, it includes active and explicit processing of an extraordinary experience with the goal of a change of experience, behavior, or generalized attitude. In accordance with clients and patients who wish to do that work, if you go to self-development or after therapy, I like the question very well. If you go to after therapy phases, I think we have to clarify what the goal of this work is, and call it eudaimonia, call it salutogenesis, call it a better state of human functioning. But people have to work on explaining and making it transparent what it is. Integration can be considered a state, a process, and an attitude, but it is also a social norm. So I know a lot of groups where that norm is absolutely not present. It's not about integration. These are the mistakes. 2 twos. Then 3 therapists, coaches, and facilitators can and should actively support the process of integration and the general development of such an attitude. And an attitude of integration includes assigning an instrumental character to the experience. It avoids a fixation on psychoactive substances, and it's probably in favor of such an ethics of consciousness that helps people to become aware of what's really valuable here. It's not just dropping a substance, but looking for a state that helps to flourish in life afterwards. I think I'll stop it from here. Thank you for your attention.
Yes, thank you very much. It's not hard to see why this topic is so important. If psychedelic therapy is going to become more frequent, well, we need integration too, and it's bigger than psychedelic therapy. I'm glad you made that point. We do have some time for questions, so yeah, right here.
Thank you, Henrik. It's so really thoughtful presentation. So many references to great psychologists like Jean Piaget. Amazing. So my question, I'm a big fan of Carl Jung psychology, and he says that we in a story, and sometimes we unconsciously can live a tragedy of the family member. and and again, correct me if I'm wrong. With the psychotherapy integration, the idea is to live life with a higher consciousness.
More awareness.
That's my question.
Is it? You mean?
Yes.
I think that concept of becoming more aware of our impulses, becoming more aware of our goals, becoming more aware of how our social setting forms our emerging self is a very important goal, and it should be part of the process of integration. Then again, I say the same thing that I said before. Awareness is not a goal in itself. Awareness is a part of a fully lived, embodied, enacted life. We need to make behaviors out of awareness. And it could be the behavior sitting in a Zen dojo all your life, of course, but likely 8 billion people will not sit in a Zen dojo. So we need to build airplanes, grow food, and make peace with other nations too.
Thank you.
All right. Can we take one from the online audience?
Yeah, there is one question from Chris asking or relating to that the experiences you make are often very, very different. So that determines what you need to integrate and how does this affect the important project of
Operationalizing.
Yeah, thank you. I always jump.
How does the experience be operationalized?
Yeah, due to all the different kind of experiences you make.
Yeah, that's exactly what we're trying to do in a questionnaire that typologizes different aspects of the experience. We are not the first ones, so we can build on a rich history of typology of experiences, and of course a typology always leaves out part of a personal experience, but a personal experience can only be had by a subject. so I think it's possible to typologize and help people by typologizing, even understanding their personal experiences better. But still it's difficult. Yeah.
Okay, let's take one more quick one before we go to lunch. Back there, yeah, in the back.
Hi, Henrik.
Hello.
I'm very curious, given your background in ritual theory and ritual research, how much do you value a well set up ritual design for the intake of psychedelics for the process of integration later?
Yes, so we have a history. She was a student in a collaborative research area. I think a student, or where I was a researcher. So about ritual, I think we should intentionally not use the term ritual anymore in practice and research of psychedelics. Why? Because we have the instruments in modern society to make everything in the context transparent and clear. By the way, that's modernity anyway. Reflexivity of all elements of a context. But rituals are often traditional forms that are transferred from one generation to the other by authorities, often irrational authorities, often authorities who want to have power over you. Of course, you could like lightly using the term call your context for a psychedelic experience a ritual, but I think it misses out on the core aspects of traditional rituals. Now, we could obviously talk for one month about ritual, but I think using terms more with more awareness in the field, and making a difference between what came before us and what we are now doing, living in what is called liquid modernity, where all forms become transparent. We learn from the Amazon learns from us. That should make us very aware of not reproducing mistakes of the past.
Okay, that's all the time we have. Thank you again to Henrik. Thank you to everybody in the audience.